Hello everyone, I am Hanz Shelley Dal and I will be your student nurse for today. So today I will be assessing the thorax. Hello ma'am, good morning. My name is Hans, your student nurse for today. So may I know your name ma'am?
I am Carl Dal.
Okay, so when is your birthday?
My birthday is on July 16th, 2001.
Okay, so ma'am, I'm going to assess your anterior and posterior thorax. So the procedure is I'm going to touch and expose the parts of your body. Then there are some instructions that you should follow during this assessment. Is that okay?
Yes.
Okay, but before that, I am going to have some questions to be followed. So, do you have any chest pains right now?
No.
Do you have some random problems of breathing?
No.
Okay. So, ma'am, as you can observe, I have already closed the curtains for your privacy and confidentiality. So, do you have any questions or clarification?
No.
Okay, so before we start, I am going to sanitize my hands to secure that my hands are clean and away from microorganisms. Okay, so ma'am, I am going to assess you. Ma'am, are you ready?
Yes.
So first, I'm going to inspect the shape and symmetry of the thorax from the posterior and lateral views. Then compare the anterior, posterior, and lateral diameter. Okay, so the thorax is symmetric. Okay, so next is I'm going to inspect the spinal alignment for deformities. So can you please stand up? Sir, ma'am. Okay. So I am going to observe the three normal curvature, which is the cervical, thoracic, and lumbar. So the spine is normally aligned. So now I am going to palpate the posterior thorax. Okay, so everything is normal. There are no swelling or tenderness. So next, I'm going to palpate the posterior chest for respiratory using my thumbs. Okay. Deep breath. Okay, so it is normal since both of my thumbs move along with her breathing. So next, I'm going to palpate the chest for vocal formitus. So I will use both hands. Okay. So ma'am, can you say 99 as I touch you back? Okay. So 1, 2, 3.
99.
Okay. I'm going to percuss the thorax and percuss the diaphragmatic exertion using a zigzag pattern. Okay. So, ma'am, can you take a deep breath and let it out? While I do some percussion, take a deep breath, another deep breath. Hold it, okay? So now I am going to measure it. Hold it. Okay. So as I measure it, it is 5 cm, which is the expected measurement. Okay, so the last step is I'm going to auscultate. So, with this stethoscope, I'm going to auscultate now. So, ma'am, can you please inhale and then exhale slowly to the mouth? Again, ma'am. Exhale. Again. Exhale. Lima. Okay, so for the findings, it is all normal. Okay, so let's proceed to the anterior thorax. So first, I need to observe the breathing pattern of the patient. So I can see that the patient is breathing fine and effortless. So next, we are going to inspect the costal angle and the angle of each ribs and then the spine. So, okay, the costal angle is 90 degrees, which is normal. So, next we are going to palpate the anterior thorax. Everything is normal. There are no swelling or tenderness. Okay, so now we are going to palpate the tactile formitus in the same manner as the posterior chest. Okay, ma'am. So can you say 99, ma'am?
99. 99.
Sige, ma'am.
99.
Okay, so it is normal. So now we are going to palpate the anterior chest for respiratory exertion. Okay, ma'am. Inhale. Exhale. So breathing is normal. So now I am going to percuss the anterior chest systematically. So it is normal. Now I am going to auscultate the lungs to anterior thorax using the stethoscope. Breathe in, ma'am. Breathe out. Breathe in, ma'am. Breathe out. So there are no abnormalities. So the results are normal. Now that the assessment is done, I'm going to assess the patient in replacing the glove. And then I am going to sanitize my hands. And then document the findings of the result of the assessment. Okay, ma'am. So I am done with the thorax assessment, ma'am. So thank you for your cooperation, ma'am, and have a good day.